curriculum structure that being designed is focusing on the technical and practical, so that the students are not only focusing on the theoretical part. We offered the curriculum structure which focus on the medical devices equipment, where students will apply all the maintenance of the devices which they can find in the hospital, planning, management, but they are also focusing on the technical. So this technical part will form a competent engineer in terms of management.
I chose to study in UoC because it's taking us to a real life of a biomedical engineer. They're teaching you how to maintain the medical device.
Physiotherapy is basically offers a challenging, rewarding and satisfying goals. It's a program that provide students and graduates with the skills, knowledge and practical skills that they will learn from the classroom learning as well as clinical placement. Physiotherapists play a major role in getting a patient or individual returned back to their normal activities, promote or improve their health, well-being as well as quality of life.
A lot of equipment of this facility, which like the gym lab and also the rehab lab, which is I can explore a lot of equipment like the modalities, even the very updated and also the very advanced one. So whenever I go to any center or hospital, I know how to use the old one and also the new one.
There are a lot of things which attracted me to study physiotherapy. The most important one is that I always wanted to help people in any way I can, and physiotherapy is a way I can actually help people. So that's why I chose physiotherapy. I chose to further my study at UoC because UoC is one of the greatest universities I've ever seen in Malaysia. The UoC has helped me a lot. They made me really confident. My university made sure that I don't regret at all.
A medical assistant is also known as assistant medical officer, which is one of the important medical personnel in our healthcare system. So actually you can find this profession in the hospital, clinic and other healthcare facilities. As an assistant medical officer in private hospital, government hospital and also other industries such as oil and gas and also insurance company.
I'm studying medical assistant in University of Cyberjaya. The thing that is really attract me to study here is it have a great faculties and provide the best learning education to students in medical, medicine and so on. My lecturers been very friendly, which I'm so grateful. They would give advices and even tell me what should I do, and sometimes they teach me on how to make a decision.
Seterusnya, majlis diserakan lagi dengan ucapan dari Puan Dina Adam, Program Penyelaras Fakulti Sains Kesihatan Bersekutu. Dengan segala hormatnya, dipersilakan.
Assalamualaikum and very good morning to the students. I heard that you are from the SMK Convert Kajang. Nice meeting you all here. So this session is going to be leisure and just make yourself comfortable. You can just ask me questions in between if you do have a questions to ask. All right. So today I'm going to share with you what is actually physiotherapy. How many of you understand or know what are the roles of the physiotherapists here? That's good, quite a number of you. Did you ever go to any physiotherapy unit in the hospitals? No center? All right, so we'll go in depth about that. In my slide, I probably like to share more of what are the roles of being a physiotherapist. But, and of course, there's a few things that we must know before we can be a physiotherapist. Okay. So moving towards physiotherapy career. Any one of you here have interest in physiotherapy career? or you don't have any idea what is physiotherapy yet, but you've been to the hospital, bringing your family members to the hospital? Yeah? Okay, that's good. All right, so physiotherapists is actually help people rehabilitate or try to get them back to their normal living. That is our aims, being a physiotherapy. So what is physiotherapy is? It is a profession, in fact. We are professional. When you are a physiotherapist, you are considered as a professional. Okay? So physiotherapist is a profession where you are always learning new things every day, new conditions, illnesses, disability, every day. You are going to learn something new. And the most important thing is helping people. Any one of you here have that intentions in your life, helping people? Not only in your family member, but others apart from your family members. That's good. I want to see that spirit. Okay? So is a physiotherapy is the right career for us, for you? Is it a right career for you? Do you have a visions that you want to be a physiotherapist in future? 5 years to come? Okay. All right, 5 years to come or 3 years to come, you have this something in mind. You have see your future by experiencing it, or something that you see from your pengalaman bersama keluarga. You're sending your family members to the hospital. Any one of your family member had an accident? Yes? Stroke? That's good. And do you see how much roles that physiotherapy offers? Do you see that? That helps a lot in getting them back to their normal living. That is our aim. And itulah peranan kami sebagai physiotherapist. Most important thing, to become a physiotherapist, first you must be interested in human body works. You know what is human body works? Keseluruhan badan kita, function. Contoh, you tak boleh bangun pagi. Any one of you here ever experience salah bantal? Itu salah satu condition yang sangat simple. Salah bantal. You can see physiotherapy. Yeah. Right neck. We call it right neck. Terselio, sprained ankle during your sport time. Yeah, there's a basic treatments that you must learn. Sangat-sangat simple. Penggunaan ice. Okay. Macam mana you want to get them back to their normal functions is important. How to get them to walk again or to go back to their normal living. Itu aim kita. Right? So you must have this interest in human body work and also their moves. Right? And as I experience, most physiotherapists have a very sharp eyes. If you work with limping gait, we know which part of your body is injured. Trust me. Okay? Because we have been trained to analyze people. And the second one, do you like to interact directly with your patients? It's interesting. Yeah, you suka tak dealing dengan human? Particularly with patients, client. Okay, so that is our core. Okay, no client job. Betul tak? Tak ada patients, tak ada kerja. Kalau semua sihat macam mana? Tak ada kerja, betul tak? So we want you to have this, what do you call it, interest. You nak jaga orang sakit. You nak bagi improve their functions. That is the most beautiful thing about physiotherapy. And the third one, are you interested in hands-on career? I can see that. You know what is hands-on? Apa perbezaan hands-on dan bukan hands-on? Yeah, you must have a touch A good touch. Miracle touch. Pegang je terus jalan. Kan? But of course you must have a knowledge. Being a physiotherapist kena ada knowledge. Okay? And not only hands-on skills, but you must have other kategori yang lain. Karakter yang penting. For example, your interpersonal skills. What do you understand of interpersonal skills? You're able to communicate with others, with doctors, with pharmacists. You can communicate well with dietitians, right? Occupational therapists. We work as a team in a hospital setting, all right? So we cannot work alone. Kita boleh kerja seorang tak? No. We must have someone else with us. What is our aim? Is the only one aim, to get patients back to their normal living. Betul tak? Okay. The fifth one, I would say, is an effective communicator. How you describe yourself as an effective communicator? Okay. Too much talking? Acceptable. Apa effective communicator? You tahu bila masa you nak bercakap sesuatu yang sensitif. When should you just omit some questions? You communicate well with other multidisciplinary team. Macam mana you nak discuss teams? How to improve the patients as a whole. So our approach is similar to pharmacies. It's an holistic approach. Okay, bila kita ada work round, actually there will be a doctor, rehab team, there will be a pharmacist, and the nurses. Okay, sangat penting. Okay, bila kita buat work round. The next one, this is important. Can you motivate people? Are you a good motivator? You can learn. You can learn to be a good motivator from our program. Trust me. Yes, you can be a good teacher as well. Good educators, good motivator. Can you describe how this motivator works in our professions? Okay, so you must encourage your patients most of the time. Okay, you can do it. Come on, a little bit more. You can work faster. I can see you can do that. Okay, most of the time we motivate our patients because we love our patients. Okay, we love them. Okay, we want to give the best treatment to our patients. Okay, the next one is you must excel in science. Yeah. You must good in your anatomy. In semester 1, there will be an anatomy 1, and semester 2 will be an anatomy 2. Okay, so you must excel there. Why do you think anatomy is important for physiotherapy? Body parts, what muscles work, okay? Nervous system, wonderful. You have a good knowledge of physiotherapy. Okay, biology, all right? Without forgetting others, like physiology, will be offered in semester 1 and 2 as well. But you must master your anatomy, right? And last but not least, you must be an empathetic person. Empathetic, kesian. You always kesian. Bila kesian, what would you do? Willing to help, right? Always put yourself in your patient's shoes, right? Kesian. So we have to get them back to their normal activities, as normal as possible. We don't promise them that they were gonna heal 100%, but we can promise them that they can get back as normal as possible. All right? So why you choose physiotherapy? I know it's not now, but in future, 2 years to come, 3 years, 5 years to come, why you choose physiotherapy? Because my mom asked me to do that? No, you must have a patience about these professions. As I tell you just now, you have heart in helping people. Nak bantu orang, kan? Supaya semua orang boleh balik seperti asal. Not because your parents want you to be a physiotherapist. It has to come from your heart. You are right. Okay? Why I choose physiotherapist? First thing is because I have patience to help other people. I like to help people. All right? And this physiotherapy job is actually a promising job prospect. You can work everywhere. It's job waiting for you, not you looking for a job. You believe me? Do you believe me? Yeah. And again, you have to excel. Show your interest, your capability. For sure, people will look for you, right? So it's a very promising job prospect. You can work everywhere. You can work in a hospital. You can work in clinics, physiotherapy clinics. You can work with a society. And you can be a volunteer. Right? And after certain times, you're probably tired of seeing patients. You like to be something else, entrepreneur. Open up or set up your own clinics. Or you probably like to be an educator, right? Even though I'm an educator, but by professions, I am still a physiotherapist. Okay, I still treat patients. The next one is satisfying income. Okay, the income is very satisfying. I would say that apart from your normal income, you can do locum off of the working hours, not during working hours. Do locum, home visit, and all those. They pay you quite a lot of money too, all right? But of course, it requires your commitment, your time, commitment, and all those. The third one, physiotherapist, is high demand professions. Why do you think it is a high demand professions? Any idea? We get sick every day. We injure ourselves every day. Not only us, but our family members and community. Right? How many of you here experience ankle sprain? Yeah. See? You wear high heels? You sprain because sport? Suddenly. And slip and fall. Yeah, humans do activities every day, 24 hours 7. Every second, we move our body, and we cannot escape from injured ourselves. That is for sure. All right? And furthermore, and of course, when you are young, injury could be very less compared to elderly at certain age. So that is why I say we are in demand. People, community need us from the all range of ages, from the baby, newborn baby, up to elderly. All right? Do you know what we can do with a newborn baby? Yeah, do suctions. We can also mobilize them, okay? Positions them so their lung will be improved if they have respiratory problems. That one you will see a lot in the neonatal ICU. Right, the next one is safe and trusted professions. What do you think this will be? Why is it safe and trusted? Why are these professions safe and trusted? We don't deal with needles. We do a lot of manual therapy, right? And just a part of our therapy, we may require some machines, but most of the time, we encourage more manual therapy. Okay, you know what is manual therapy? Hands-on skills, right? We just don't do massage, we do more than that, right? And we work in variety of work environment. We can work everywhere, just with the two hands. Put us everywhere you can just survive, right? Because you learned about manual skills, hands-on skills and all those. And these professions is actually a very rewarding career. Why do you think physiotherapist is rewarding career? Rewarding career? Yeah, could be one of the reasons. So whenever we achieve positive outcome, what do you feel? Happy. When you see patients from lying down in bed, can't even move, and after a few sessions of physiotherapy, patients can sit up at the side of the bed, stand, and start walking. Is that so rewarding? Yeah, it is so giving you some satisfactions there about these professions, right? So getting back to your interest just now, you must be passionate about this, dealing with human. Any questions so far? Okay. Okay, so why actually physiotherapist is the highest progressing, fastest progressing jobs. Fastest, you progress very fast. You explore a lot of areas, okay? And how do we explain the demand and the growth of physiotherapists in the field? A few reasons is because increased recognitions of the importance of these professions, right? I think from today onward, you must put in your mind that you know about physiotherapy. Can you promise this? You know what is physiotherapy? Right, help people. That is what we want. So you bring this message to your family members, to your friends. Right, physiotherapist is actually in demand. Physiotherapy is helping people, right? And we learn. Physiotherapist is actually learning new things every day. Okay? That is an important thing. Recognitions. You know, before they say physiotherapist is what? Oh, doing massage. You know that? Massage is just a small part of our manual therapy techniques. We don't do purely massage. We do massage for relaxations, improve the pain, right? And also to help to relieve the pain. Okay, the second one is aging populations. You have your grandparents, your mom, okay, is going to be an aging populations in 2030. Okay, and the population is said to be increases up to 15% from current populations. So the demand for physiotherapists is going to be high, right? So you are going to be a caretaker for elderly. 5 years to come, 10 years to come, right? And not only a caretaker, but you could be become an entrepreneur. Or open up, set up your own center, nursing home and all those, all right? The third one is rehabilitations is increasingly necessary. Why do you think rehab is important? After the sprain, how long do you have to work limping? 1 week? Do you want to work limping for the whole of your life? That is why rehabilitations is important. We must teach you what to do during the acute stage and how to relieve the pain, how to improve the range of motions, how to improve the muscle strength, and how to get back to your normal activities. Learn how to balance yourself, improve your stability and all those. And we also provide and offer, physiotherapists also offer educations. Okay, we just don't treat, okay, bye, you go home. We usually treat and educate our patients. What is brain drain? Any idea? brain drain. Do you like to work overseas? Of course, no. If you are still young, strong, energetic, why not take this opportunity to emigrate to other countries? Immigrate means that someone with high qualifications, professions coming into Malaysia. Brain drain allows you to go out to other countries. What is the idea to migrate to the different countries? Is for better quality of living, better salary. I can see that, big eyes, because big salaries, right? And of course, you probably want to earn experience there. You want to gain more experience in different countries. So, well, that is why the growth physiotherapists is considered as the fastest growing professions worldwide, right? You can work in Qatar, you can work in Singapore, you can work in Australia, right? For a better income. But of course, we expecting you to serve our community for first few years to gain more experience, right? Considering a different various culture, right? No questions so far? Okay. Okay, so this is about the physiotherapy salary in Malaysia. Average salary for PT is about 30K for the young one. And for bachelor students, they varies from 2,200 to 2,400, right, for bachelor. Compared to diploma, I would think it's about 1,800 per month. But of course, apart from that, you still can go for your house call, gaining more experience outside, because there are more and more people needs our services at home, right? And most people move on to other job if they have more than 10 years experience, right? As you see the graph there, only about 16% fresh graduate will stay in their current workplace, and then about 56% for those having experience 1 to 4 years. And as you see here, quite a number of them start moving to other or different hospital or center to get more experience, and of course, to get more pay, right? And as you see here, only 1% those with 20 years experience, right? They are not moving, they will stay, all right? So this is considered like critical years, 1 to 4 years for physiotherapists, which is having this more maximum is 4 years. All right, benefit of physical therapist career. You know what is the difference between physiotherapy, physical therapy, physiotherapy if you go to general hospital, or pemulihan cara kerja? No, pemulihan physiotherapy. Okay, so the difference is just actually the same. There's no different. Only physical therapy they use this term in United States. Physiotherapists is mainly used in Ireland and also Australia. So you can choose which one you like, physical therapist or physiotherapist. It doesn't matter. Right. So what are the benefits of being a physiotherapist? Why you choose this career? One is you want to make a difference. You want to make other people's life difference and yourself difference. All right? And of course, the most satisfactions job, okay, is this physiotherapist. So you can make other people's life also different. From not being able to walk, being able to walk after physiotherapy sessions. From stroke, just lying down in bed, you're able to get them out of the bed in the wheelchair and move around. That is most important. All right, this is important. Be a movement expert. Okay, you want to improve people's life. You want to ensure you are expert in movement. Okay, so you learn, you practice. Okay, so there's a lot of area that you can be involved. If you probably like to be specialized, you can be a musculoskeletal specialist, you can be a neurology specialist, you can be cardiorespiratory specialist, and ICU specialist. Okay? So you choose which pathway you like to go. In depth, all right? Okay, the third one, physiotherapists offer you, you will enjoy the job security. Okay, because we are moving towards the autonomy. Okay, maksudnya bila autonomy tu, you ada hak untuk memberi keputusan kepada pesakit, give a proper decisions for your patients, right? So that is why it is considered job security when you have an autonomy. Okay, there's a good side of it. Of course, you must love your job. Whatever you do, you must be passionate because you have interest in that, right? Choose your locations. We are everywhere. You can work everywhere, right? In the community, in rural, in the city. What else? Other country, next to your house also can. You can open up your own or set up your own center and be an entrepreneur. Okay, setting up your own clinics. Any one of you here interested in business? Business? Yeah, so you can be an entrepreneur. Set up your own physio center. Okay? Okay, I like to emphasize a few things here. These 3 things about misperceptions of physiotherapy. Right? We are no longer called as massage lady. No. We are not a masseur lady, we don't. But in certain area, like in sport injuries, in the ISN, they do have a person who just do the massage. Okay? They are very specialized in that. And they can offer a lot of techniques in massage itself. Okay? Massage is just not one technique. They have various techniques. Depend on the conditions. The second one is an aerobic instructor. We can be a part of aerobic instructor, but we are not an aerobic instructor. Okay? Anyone can be this aerobic instructor. Semua boleh. Kita cuma sebahagian daripada dia. Okay? Because our aims is to get other people back to normal. We want to improve their quality of life. We want to improve their endurance. We want to improve their stamina. From this method, exercise. You boleh incorporate exercise dengan pelbagai cara. Percaya tak? How do you exercise? Sit up 100 times. Push up. Can you incorporate with other technique? Swimming. We have hydrotherapy in our modules. Okay, we teach students how to incorporate swimming into exercises. Right? You don't believe that? We can do that. Right? And also other method like with the dumbbell or even just a walk. Jalan pun is a part of exercise. Itu cara kita nak incorporate. Dancing, How many of you like dancing here? Yeah. Dancing, you can incorporate dancing into exercises too. So exercise can be very wide range. You choose it. Which one you like or prefer? Nak dancing sebagai satu cara untuk exercise, nak jogging sebagai satu cara exercise, nak guna modalities pun boleh. Right? Treadmills and all those. So we are not just an aerobic instructor. We are more than that. All right, we only treat healthy people who are injured. No, we treat everyone. As I mentioned, all range of ages, from the newborn baby up to the elderly. Itu tugas kita, peranan kita. You can see our roles in the ICU. You can see our roles during the acute management in the hospital, post-surgery. Ada tak family yang lepas surgery? Major surgery. Open heart surgery. Yeah. What else? Laparotomy. Right? So we offer help to get them out of the bed and to ensure they can go home. And how they walk to the toilet, those functions is very important. All right. No questions? Okay, how do we see physiotherapy in future? As I said, we are going to learn. We are learning, always learning new things, right? So what we are looking in future, of course, any other method to treat elderly, to improve their functions, because in 2030, it's going to be an aging nations. 2030 merupakan tahun di mana ramai orang-orang tua. So baby boomers, orang tua lah. So you must gather your roles, peranan untuk membantu our elderly, right? Especially in this Age Nations year 2030, right? Maksudnya you ada peluang pekerjaan. You tak adalah keluar saja, tak ada pekerjaan. Because by looking at this, a lot of future opportunities that you can have, right? The second one is technology. We involve a lot with the technology as well. Advanced machines, advanced and sophisticated machines. Not only ultrasounds, but we have big machines that helps to analyze data, more like research equipments, right? So you can be part of that. With your knowledge, as a physiotherapist, you can be a salesperson for that machines, right? And that job is everywhere now. The next one is reimbursement. Insurance company, okay? When we are recognized by the insurance company, they can offer this support for those who insured with them. Whatever rehabilitation treatment will be covered by the insurance, right? So we are looking into this. So you don't have to pay too much. Insurance will pay for you, right? In future, this is what we are looking forward for. And the next one is female athletics. How many of you here athletes? School athletes? Yeah. You female, right? You need a female therapist for female athletics. Right. So we have a kind of a better understanding of female therapists and female athletics. So we are looking towards this as well. The next one is vet care. Anyone here know what is vet care? Do you love cats? Of course, dogs. Okay, that's good. Right. We can treat vet in future. Cats, dogs, or even horses. Right? If they are injured, we can ensure that they return to the normal livings. They should be able to walk around again. That is fun, right? Because your love towards your cats, your pet, you must also show or share whatever you have, right? So this is what we are looking into in future, working with veterinary to treat cats, dogs, horses, whatever animals that having injury. The next one is autonomy. I think I have discussed autonomy previously about how much you were given an opportunity to decide best treatment modalities for your patients. You are more like thinking critically now, so you were given this opportunity. And the next one is the need for research. How many of you want to be a scientist? Yeah, I'm sure you are. You have this patience. You want to improve the nations, right? You want to improve the world. So you have to be ambitious. Ambitious. Be a scientist. We need scientists for physiotherapy in future, right? We want the best clinical reasoning treatments, how to improve certain conditions. Okay. All right, so those are the roles of physiotherapists. We want to identify. It means that you have to find out what are the problems your patients have, right? And that has to come from your assessment. How do you assess your patients? Apa you kena tengok? Dari kepala sampai kaki, dari kaki ke kepala. You kena assess semua. Subjective assessment, local assessment, that is important. Without assessment, you may not be able to identify their problems. And eventually what will happen? You will have your own physiotherapy impressions, right? So that is important. From the assessment, you will know the problems, and then from the problems, you will solve the problems. Okay, and educate them. All right, education is also important, so you will know that they will not come back. No occurrence of the problems. The next one is promote health and well-being. Are you happy? You have a quality of life? How do you describe quality of life? Eat nice food, being able to watch movies, walk with friends. It's all quality of life. So different individuals have a different way of their describing their quality of life. Okay? So this is what we want to promote. We want it to be healthy. We want our patients to be healthy. Family members around us to be healthy. Right? And also at the same time, we want to improve their quality of life. Okay, let's talk about an elderly. In 2030, when there's so many elderly, how do you improve their quality of life? So that is something you have to think about later. Okay, the next one assists the rehabilitations by developing, restoring functions, particularly in neuromuscular patients with stroke, patients post sport injuries, okay, and some therapeutic exercises that helps them to strengthen the muscles, and applications of technology equipments like machines or advanced technology, right, for the research and all those. Last one, provide advice how to avoid injury and self-manage long-term conditions. Right, for those who had ever experienced injuries, how do you prevent yourself from re-injured again? Do someone educate you what to do? Yes. Yeah, that's a good one. Right, so someone must teach you what to do so it will not reoccur again. That is important. Right. Okay, educations. Physiotherapists, I would say we are therapists. We are teachers. We are advocates. We are professionals. And we are also researchers. So we have many roles, not only treating patients, but at the same time we educate them. We are teachers. Okay, semua physiotherapists actually kalau dia experience, dia dah boleh jadi cikgu. Okay, cikgu kepada pesakit dia, cikgu kepada the carers, cikgu kepada family member dia. Okay, they must educate the family members as well. All right? Okay, these are the scope of physiotherapy. You can work in geriatrics. Geriatric ni untuk orang tua, elderly. Geriatrics. Intensive care, ada tak pernah masuk intensive care? Tak, itu core saya. Saya suka ICU. And the next one is mental health. Kenapa mental health dia relate kepada fisioterapi? Sometimes when you are depressed, you banyak tidur, your muscle weak, we have to improve that muscle strength. Or sometimes kita nak dia have a quality of life. Apa kita kena buat? Right? So you must be very creative. The next one is occupational health. If you work, a lot of lifting and all those, you may end up with back problems and all those. You may come to a physiotherapy for an advice, treatments and advice. Outpatient department, patients ni kalau patients daripada hospital balik rumah and then for follow up, they must go to outpatients. Orthopedic, tahu tak orthopedic? Ya, bone doctor. Excellent. Kalau you ada injury, fracture lepas accident, you will be placed in orthopedic ward. And then the Paediatrics. Siapa tahu Paediatrics? Yes, kids. Peds doctor. Siapa suka kanak-kanak? Oh, okay, that's good. Actually, it's very interesting working with kids and babies. They are fun. We do more on play activities. Kita banyak bermain dengan kanak-kanak. Stroke. Siapa tahu? Angin ahmar, stroke, saya rasa, you must ever experience that with your family members and all. Okay, last one, women's health. Apa kita boleh buat untuk kesihatan wanita ni? Prenatal, postnatal. You kena ajar kalau cesarean patients macam mana nak jalan, nak bangun. Right? You know cesarean? Okay? That is in acute stage. Kita kena jumpa dia and teach them how to get up from the bed. How to sit into the toilet. Kalau dia ada squatting toilet or sitting toilet. There's many way of helping them. Right? When others, any idea? Kegel exercise, pernah dengar tak? Incontinence, nenek-nenek, mak-mak kita kan, selalu terkucir. Ketawa je terkucir, bersin je terkucir. Kan, terkencing. We teach them a proper exercise technique that helps them to regain back the strength of their pelvic floor. Okay, these are some of the scenarios you probably may ever seen this before, like sport injuries. Okay, whatever tournament, sport tournament, there will be a physiotherapist assisting. Dah tunggu dah kat tepi. Injured saja, physiotherapist come. Are you interested in sport? Probably guys. If you're interested in sport, you can be involved in sport rehab. You can assist the sport teams in future. How about this disability? Have you seen someone without leg? How to walk them? How to ensure they have a good quality of life though they are handicapped? Pernah tak you terfikir? Macam mana nak bagi dia ni? Dia punya quality of life we can achieve to the fullest. So we must teach them how to use crutches. How to adapting to the new prosthesis. Right? How to wheel the wheelchair. Macam mana nak naik tangga, turun tangga. Right? They have to gain that skills. Siapa yang ajar? The rehabilitation team. I won't say physiotherapy saja. Kita ada rehab teams yang sangat supportive. We may have to get our occupational therapists as well. Okay, part of our rehab teams. Without our others multidisciplinary teams, we may not be able to achieve this goal. Right? How about this? Fracture, post-accident, patah sini, patah sana. Macam mana nak bagi dia bangun? Okay? Bila nak suruh pusing je, kan? We have a skill how to manage patients like this. all right? Not only to get them out of the bed, but at the same time, we want to motivate them. How to teach them to use crutches, how to get them to walk up and down stairs. It's important, okay? And this is elderly. This program is actually being done in Rumah Sri Kenangan, Cheras. And we have quite a number of elderly patients, right? They are very supportive. They are, I would say they are healthy, but how to improve their quality of life? They are usually lonely, they're sunyi, so we have to go there and support and motivate them and ensure they gain the quality of lives. Peds, Paediatrics, okay, babies, as early as newborn baby, right? Like these conditions, probably this baby have respiratory problems, okay? And this probably special needs children yang ada spastic. Kita kena loosen the muscles in the water, hydrotherapy sessions. We also have to improve their functions, motor functions, improve their milestone. Okay, kita kena ajar dia. Walaupun delay, but we still have to improve that. Musculoskeletal, muscles dan muscle dan tulang. I'm sure you have seen this a lot. Okay. But bear in mind that we don't do a lot of manipulations. Ini manipulations. Kita buat lebih kepada manual technique. For those who are very expert in manipulations, they can't offer this service. But of course, you have seen this a lot in outpatient services. We teach them how to balance with the rubber boat, how to strengthen the lower limbs. For the elderly, kita encourage them more on like sitting, and for sport persons. All right, so many methods. Neurology. This patient is having stroke. With this advanced technology, we can get him up and about using these machines. There's an hoist here to hold the patient, so patients will feel very secured. Dia akan rasa sangat safety is there, right? And they must go the steps to improve the strength, all right? You can be an educator. Okay, siapa nak jadi cikgu sini? We are teacher. Yeah, you can be a teacher in the clinical setting. You can also be a teacher in the graduate schools, university. Okay, you will be a teacher everywhere. You educate your patients. Right, so these are the services that you can find in the hospital. Right, medical is mainly to cater those with respiratory problems. Okay, yang macam recently COVID-19, those viruses will affect your lung, they will be parked under medical. Right, surgical ward, post surgery like laparotomy, pembedahan perut, okay, ataupun pembedahan lain, yang major surgery, they will place it in surgical ward, anesthetic. This is mainly in ICU. We work closely with anesthetists, so we can get patients in ICU, sit up in the bed and walk. That is what we do. Orthopedic, tulang, kalau ada patah, right? Any injuries to the bone, for plaster of Paris or for the metal implant, kita akan place them in orthopedic ward. Neurology, kalau ada involvement with the saraf otak, stroke patients, trauma and emergency, urology and nephrology, berkenaan dengan kidney, kita also offer services, bantu pesakit yang mengalami buah pinggang untuk berjalan, try to get them back as functions as possible. Obstetric and gynecology, okay, selepas pembedahan, cesareans and all those, so any obstetric conditions. Geriatrics untuk elderly, PITS untuk kanak-kanak, rehabilitation medicines, ini keseluruhan untuk rehabilitations, radiotherapy, oncology and all those. Okay, so who are our employer? Physiotherapy boleh bekerja di mana? We can work in private hospitals. I think now like mushrooming, hospital private, you can work anywhere as you like. We can work in the government hospitals, but of course the seat is quite limited. You can set up your own private clinics and also health center. If you like to be involved with more healthy people, you can set up your fitness center, schools and children's centers, residential homes, and day center for elderly homes, okay, elderly people, rumah orang tua, okay, or folks homes, and any charities and voluntary organizations macam penyayang ataupun NASAM, ada banyak. In any sport clinics, professional sport club, gyms and leisure center, we also involve with those fit and healthy people, and armed services. Tadi, think during the pharmacy talk, they send their students to the Had Tengkumizan, right? So they're exposed to these army services. Di pusat-pusat hospital, army services ni pun dia ada physiotherapy center dia. Okay, so you can be those specialized in this area. There's a lot of job scope. You can work in cardiovascular and pulmonary, right? You can work in, this is basically in ICU as well. There are the specialized physiotherapists in ICU, then the medical ward. Clinical electrophysiology involves with machines and any electronic technologies. Orang tua, geriatrics, neurology, orthopedics, PITS, sport physical therapy, outpatients, industrial and workplace environments. Yep. You could be a consultant for a big company, right? Teach the workers how to maintain a good health, how to do a proper ergonomics. Sometimes we have quite a number of workers from industrial yang having neck pain, back pain and all those. Women's health, and you can also be a sales personnel. Tadi kita dah bincangkan, you can promote machines related to physiotherapy. Okay, career prospect. We have about 1,252 hospitals, hospital kerajaan di mana kita boleh bekerja di sini, banyak tu. And about 297 primary healthcare, klinik-klinik kesihatan di mana kita park juga kita punya fisioterapi di sana. I mean physiotherapists can work there. And any other cadres posts, you cadres those Ministry of Social Welfare, NGOs, alright, Ministry of Defence macam hospital terendah, also sports schools, ISN. Okay. So this is where you can see penjawatan. Ini data daripada Kementerian Kesihatan 2021. So you can see a lot of posts there. Okay, let's talk about career pathway. We can start from diploma. Diploma daripada SPM, you boleh mohon ke diploma. But here in UoC, we only have bachelor in physiotherapy programs. And also master in physiotherapy, right? Specialized in musculoskeletal and neurology. So as you see the career pathway here, prospeknya sangat bagus. From diploma, you can pursue your bachelor. If you want to go more advanced, you can go for master in physiotherapies. And if you like to do research, be scientist, you could be involved with PhD. You can pursue your studies. Sorry, more in depth to PhD. All right. I think a few more slides. Once you have got relevant experience, there are opportunity to move into a more senior post. I think this is what the norms. Kalau you dah berpengalaman, you akan hold positions like managers and all those. And you may also have an opportunity in teaching. Okay, we want someone with experience to teach, training, or obviously research. Alternately, you may choose to work in private practice or in KKM, Ministry of Health, right? And then progress to open your own practice and become self-employed. Tadi ramai yang nak jadi entrepreneur kan? Buka ataupun set up your own clinics, physiotherapy clinic. You boleh jumpa di mana-mana physiotherapy clinics. It's easily can be found. Alright, so this is actually a video about You Can Be Me, but you can search it in the YouTubes. It's very interesting videos, can motivate you. It's very interesting videos. I think these are the additional sources. You can find it out. Sorry, any questions so far? Nak tanya tak? Please, please. Siapa dah jadi physiotherapist? Kalau nak masuk untuk foundations in allied health science, you kena ada 5 kredit. 2 tu necessary ialah science dan matematik, dan 3 subjek yang lain. Leading to health science. Yes, you can just choose any of your science subjects. Science, mana-mana biology plus matematik. Dan 3 lagi subjek lain. You boleh masuk foundations kami. Okay, that's a very good question. Right. If say you have a patient, you did your very best to get patients back to, try to rehabilitate them as much as you can, but it seems not working, you have to refer back to the doctor. That is why, as I said just now, you must have a very good interpersonal skills and you have to work as a team. Okay? In the hospital, we have multidisciplinary teams that consist of doctor, pharmacists, dietitians, and rehabilitation teams like physiotherapy, occupational therapists. Right? So we always relate or refer back to our physicians. Sorry? Dress code? Oh, okay. That's a good question too. Right. I can just share something based on our students' experience. We don't have that specific dress code, but our physiotherapists, color code is dark blue. If you go to the government hospital, they are wearing dark blue pants and white uniforms. But other private universities, it depends. We still try to maintain that dark blue code for our physiotherapists. Standard code, I would say. And stethoscope, well, it's quite hard to answer that. But students in our class are required to bring all their tools every time. Because we wouldn't know whether you are going to see cardiorespiratory patients only, or are you going to see musculoskeletal patients? As I said, physiotherapists must treat their patients holistically. You get what I mean? Holistically. Doesn't matter whether they are referred for ankle sprain, but they probably may have respiratory problems. You have to assess that, right? I hope that answered the questions. Any other questions from the live? Oh, all right. Yes, but that will be in ICU setting. You have to calculate ABGs and all those, right? And also, all areas as well. How do you try to get a proper weight for some exercises? You must calculate. That is why mathematics is one of our core subjects required. But in syllabus, you don't have mathematics. In foundations, yes. in physiotherapists, bachelor in physiotherapists, you just need to be, to call it, master in anatomy. Okay? Oh, okay. This program, I would say, yeah, I think all programs also hard. It is actually depends on how you see it. Is it hard or is it difficult? But so far we have survived with these professions. Yeah, during student times, it's going to be hard because you must know all area. But once you go into your master, being specialized in certain areas, I just shared just now, you will be more master into your specializations only, right? But during your bachelor in physiotherapy, you must learn all, semua. Minta maaf lah ya, because there is the need, okay? And the other question just now, sorry. Oh, practical sessions, good questions. Based on MQA requirement, we have to provide at minimum thousands hours during the 4 years of our semester. But we are more than thousands. Maksudnya semester 4, kami ada 4 minggu clinical posting. Semester 4 ada 5. Semester 6, kita ada 6 minggu clinical posting. Semester 7, kita ada 8 minggu clinical posting. Dan semester akhir, kita ada 12 minggu clinical posting. Maksudnya semester akhir itu fully clinical posting. You will be placed in ICU, in neurology ward. You akan place dekat sport, semua area. So I think this is enough hour for a student of physiotherapists. At the same time, kita ada society. So society usually will try to get some voluntary works di mana student pun boleh expose kepada community. Sorry. Any more questions? Cikgu nak tanya soalan? Any more questions? Yeah, actually, you cannot avoid yourself from seeing physiotherapists. Not you, or even your family members. Somehow going to see physiotherapists for improvement of muscle strength, nak bantu untuk berjalan, especially those experienced stroke. No more questions, Puan? No more questions from others? I think you're all hungry already. It's over. I'm sure, yeah. Your stomach, I can hear that sounds. So sorry. So sorry, the sessions is quite lengthy. All right, I think, can we stop now? Okay, thank you. Thank you for your support.